Healthcare has acquired a majority stake in Scanmed Multimedis, a private healthcare service provider in Poland. Now we're joined on the line by Life Healthcare CEO Meyer. Andre, perhaps if you can enlighten us as to what attracted you to this company in Poland.
Well, the Polish market is for us a very exciting market. It's probably where the South African market was about 15 to 20 years ago in terms of potential for consolidation in the market. Very strong expenditure in healthcare. The average annual growth in healthcare expenditure for the period 2003 to 2012 has been sitting at about 7.3%. You compare that to the UK market at 4.8%, France at 2.2%, and Germany at 2%. And there's also the quality of the management in Poland is very, very good. The quality of the outcomes, general care. So we're very excited about the acquisition.
Andre, just enlighten us further on a mandatory health insurance for employees. Quite clearly, that's another potential growth area for you.
Yes, it is. Private health insurance in the market is still fairly small. About 10% of the population is covered by private health insurance. The bulk of the funding is coming from the public sector. The public sector was another exciting opportunity for us. Is the public sector use these private facilities to provide the care, and that's another growth opportunity that we see, that the private health market and the private health insurance market will continue to grow in Poland.
Andre, it's Mark Ingham in Joburg. This is the first acquisition on your watch as the new CEO, so well done. I would anticipate, though, that given the number that's come out here, it's Polish zloty, about 4 per share. That's what, about 65 million or so zloty. So it's relatively small. I would guess that, much like Max, this is not going to be earnings accretive in the short term, but there's going to be tremendous learnings that are going to come from this.
Yeah, for us, it's initially a small transaction. If you convert it to rand, it's about 230 million rand, so it is relatively small for us. But again, the opportunity that we see is a consolidation in the market. So we want to drive a growth strategy very aggressively in the market. We've already identified a number of other potential acquisitions, hospital acquisitions that we can do in the market. So that is not, that's the initial investment for us. We certainly will be prepared to put a lot more into the country.
Andre, Ashraf Mohammed here. Just in terms of your acquisitions, you've done a small one in India, now you've done one in Poland. Do you have a geography that you're selecting, or are you looking at these acquisitions opportunistically?
We really, we previously looked more at the emerging markets, but we've come to the conclusion that those markets are becoming overpriced. We are still working with the Indian business to decide whether we want to increase our stake in the business. At this stage, the decision is not to increase the stake. We haven't agreed on any specific territory, and we rather look at the potential for growth in a market, and we've identified a market, and then to look at specific targets in those markets. And Poland for us is a very good example of that.